Welcome back to Famhealth. As we all know, September 29th is World Heart Day. And this year, the theme for World Heart Day, as set out by the World Heart Federation, is how to use your heart to beat cardiovascular disease, and also how to use your heart to practice better choices to decrease the risk factors of getting heart disease in the first place. Today, I have the distinct pleasure of having with us Dr. Devi Shetty, who is the chairman and founder of Narayana Health. Thank you so much, sir, for joining us today. And I know you have a very busy schedule, so we really appreciate the time.
Thanks, Anjana. Thank you.
You know, most people, especially in their 30s, aren't thinking about heart disease as something that's an immediate threat in your life. So why is it, how do you convince people, sir, to go in at, even in their 30s?
I would like you all to, I'm sure a lot of them do read newspapers and listening to TVs. They see this big muscular and gym coaches and the people who are fanatics. All of a sudden they drop down dead on a treadmill or in a gym. All of them did have some type of heart problem, and all of them didn't have any symptoms. Half the patients we operate today do not have symptoms. They're not having chest pain or a breathing difficulty. This is called silent ischemia. Silent ischemia leads to silent heart attack. So my sincere request to every Indian, being an Indian is a risk factor for developing coronary artery disease.
Well, that's one way to certainly think about things. So when you're talking about, like you said, Indians are genetically predisposed. Are there steps that we should take in our lives to, knowing that we already have this genetic predisposition, in order to decrease our chances of getting further risk factors or of developing some kind of further, issue?
You see, Sanjana, as you said first, young people think that they're not vulnerable for heart disease. And this is the biggest problem.
Yes, sir.
In my practice, it is not the young son bringing his old father for a heart operation. It is the old father bringing his young son for a bypass grafting. So age is no criteria in thinking about vulnerability for a heart disease. So everyone, first they should know whether they have a heart problem or not by doing various tests. Today there are tools which can predict heart attack 10 years ahead. According to me, every Indian past the age of 35 to 40, even earlier if they have a family history, must go for a CT scan. It's called CT angio. It takes only 3 seconds to find out whether they have even early disease. I work in Bangalore. We have a large number of young software engineers whose company pays for the routine tests. They go for simple tests, and most of them, or a good number of them, drink like a fish, smoke like a chimney, and they go for a simple test like a treadmill or a echo, and they say everything is fine. And they not only perpetuate the lifestyle, but they also tell others that this is the lifestyle I lead, but my heart is perfect, only to drop down dead after 6 months. If only they had a CT angio at that time, that could have been prevented. So my single message to every Indian is that if you have a family history, or if you are a diabetic or a hypertensive, please get a CT scan of the heart, CT angio. That can predict heart attack 10 years ahead and change your lifestyle.
So if we, since we are, as we talked about, predisposed to heart disease, if we do get this CT angiogram and something does come up that's not good, which is sort of to be expected given the incidence of heart disease in the country, what are some lifestyle changes that you recommend making for people who have, heart-related issues, or something that could become in the future a heart-related issue?
A lot of the heart problems, the progression of the disease can be slowed down or virtually arrested by changing the lifestyle. Lifestyle makes a big impact on the progression of the coronary artery disease. What is a lifestyle change? First, if you are a smoker, quit smoking. If you are consuming tobacco, quit tobacco. If you are obese, lose weight. If you are a diabetic, control diabetes. If you are hypertensive, control hypertension. Essentially, lead a very, very physically active life. So, just by changing lifestyle, I'm not saying you should work less. I'm not saying that you change your job or occupation to help your heart disease. I really don't know whether it will make any difference. But changing the lifestyle, changing your going away from the vices and trying to do something to keep yourself physically active will make a big, big difference.
Thank you, sir. And like you just said, younger people, it's kind of a myth in this country that young people ko heart disease nahi hoga, or that it won't happen with them. A similar myth, I guess, is that women tend to have fewer heart conditions. So can you talk a little bit about women's health and heart disease, please?
Every woman must understand that the nature wants them. So they will protect them till the age of 45, 50. But after that, if women do not control their lifestyle, if they don't take care of their health, believe me, nature drops them like a hot potato. It is very sad. It virtually dumps them when the nature thinks she's of no use to me. So it is all the more important that the women take care of their health seriously, because coronary artery disease long-term result in women are not as good as it is in men, because they tend to get diffuse disease, thin vessels, multiple blockages. These patients don't do very well even after a successful bypass or angioplasty. So women need to be very, very careful when they are young, only to enjoy sound health when they pass their prime.
Okay, thank you so much, sir. And one other question I had is about, you talked about a CT angiogram, but are there other tests that we should be getting done in order to make sure we are, CVD free, and like a cholesterol test, for example, and how does that tie into the larger picture of CVD?
See, the fundamental test is simple blood test to know the blood count and basic electrolytes. I'm not very convinced about the big impact of the cholesterol reducing agents, but an echocardiogram to know how well your heart is functioning, a CT angio to know whether you have blockages, and a simple ECG with all the blood tests can make a huge, huge difference in the long-term result of coronary artery disease.